Anthea, you've just led a very interesting discussion at a seminar we've had on the issues that face our society in dealing with the ageing population and the extent to which we are succeeding or failing in getting government to understand and take up those issues. Could you firstly just go through what you think the core issues facing the ageing population are and how we have to think about?
I think we've got to be very careful about defining an ageing population. As I said in my presentation, there's so many imponderables, even how we define an older person, because the age is changing quite rapidly. And the increasing number of very old people is also a very important one, particularly the link with dementia. But I think we've got to be cautious about other things. There are a lot of things we just don't know in the future. We don't know about patterns of migration, who's going to move here, who's going to move out. We've got to think about more people living alone, more people divorced. There's so many things that I think we need more research on, which is a research, of course, I would say, but I do think that we should be very careful not to generalise, and in particular about the differences in old age between men and women, where women are very disadvantaged as far as health is concerned, but advantaged as far as their social networks are involved.
And do you think there are any themes through this which we ought to be thinking about particularly? For example, independence in old age, for example, the role of the community and the role of society around individuals. Are there any particular themes which you'd pick out as important or less important?
I think that what we need to think about is the majority of people live in a home of their own, which is what they want to do, whether it's literally their own home that they've lived in for years or move to one. I think the key importance of housing is absolutely crucial. We talk a lot about health and social care, quite rightly, and how they should be funded. But if you've got a home, whatever age, that is the key to your physical and your mental health, and you've got to be able to live in it securely and safely.
Do you think there are issues about the extent to which people can be supported to live in their old age, for example with technology, or supported with care that may be needed to be able to stay living in your own home? Or do you think that there are elements of society which need to be encouraged for people to be able to live in their own home? Are there particular policy measures to encourage what you're saying?
Technology, yes. I would like to see more emphasis on this, but particularly on the simple things like mobile phones. I'm very dubious about robots, and I think we need to be very careful about some of the things from the point of view of the general public. For example, we had a discussion about motor scooters and whether they're dangerous, A, for the older people, but B, for other members of the public as well. I think the policy implications are incredibly wide, particularly ones with families. Families will always continue to care, but the stress on many of them is immense, particularly where there's dementia involved and there's a spouse who's trying to cope with a partner who's got dementia. I think that what older people do for themselves and their role in society is not made enough of. But volunteering, helping with families is very important for physical and mental health, both for the older people themselves and for the people they help.
You've mentioned policy implications in this area, and of course there are many organisations, central government, local government, the health service and so on, who have policies which relate to these things you've just been discussing. How good do you think those organisations are at thinking about and understanding the issues that their policies cause for this section of the population?
I think a lot of them may have the will, but they haven't really thought it through, and in particular haven't linked with older people themselves. For example, architects, local authorities need to engage with older people. Quite often it's very simple policies which will help, very, very simple ones. And of course we need emphasis on the environment and what can be helped there, but it's often very small things that are important. But yes, but the organisations don't work together, as we know. I mean, integrated care, whatever you call it, is the in thing at the moment. But we need to make sure that all the services, including health, housing, social care, work together.
The impression you gave this morning, for example, with the publication you shared about mobility of old people, is that relatively simple things could make relatively large difference in the lives of people. but it's simply that lack of listening to old people, lack of thinking about issues from the point of view of old people, which is the problem. Is that right, or have I oversimplified it in the way I've asked the question?
No, you haven't. It is simple things, like a handrail. I've got problems with my knee at the moment. I gave a presentation at a conference recently, and there was no way I could get up or down to the platform without a great deal of help. I mean, just a simple handrail. Very simple things we found in that study you mentioned was that in the parks they provide 2 seats, well, a seat which has a division in the middle, and the local authority policy is they do this because they don't want to encourage rough sleepers. But on the other hand, older people may want to sit together. They may want a bench which is just for one person, or a big one for 2. It's just little things where they need to be involved.
Because that's really an optimistic message. If it really is relatively little things which can make relatively large differences, then the challenge is how to make sure those relatively little changes actually happen.
Well, yes, it's little things that make a difference to all of our lives, throughout our lives, but I wouldn't rule out the incredible importance of the major ones. And the thing we discussed a great deal was inequalities throughout the life course. And children who start unequal are going to go through lives like that unless we do something radical. And so, although I always say my head is with older people, my heart is with children. And if I was allocating a budget, I would always emphasise children. Throughout the life course, I think the care they receive as children, throughout school and so on, is the most important thing for them, and preserving family links.
Which only emphasises the point that one has to find approaches which don't rely on money to improve lives for elderly people.
Well, let's rule out money, because I'm in favour of a hypothecated tax.
Yeah.
I think the general public would give more money if they knew it was going specifically to a particular thing, and the evidence is it's the NHS, provided they feel that the politicians will spend the money that way and not on something else. We mentioned the importance of working in later life, which is not for everybody, because people who've had a hard life in a hard job, or even a very boring one, won't want to do that. But I think for a lot of older people it is important, because volunteering is the in thing, but you don't get paid for that. So actually doing a paid job is mentally and physically and financially very satisfying.